Hi, my name's Karen Bradshaw and I have two children who have graduated through the NICU. I remember coming onto the unit the first time with Grace and being totally overwhelmed with all the clinical setting. Nobody ever thinks that you're going to be in this position. You go through pregnancy and you just assume that things are going to go well, and unfortunately sometimes that doesn't always work out and you find yourself in this setting. But it doesn't always have to be bad news. The staff on here will support you and help you through all steps of your baby's journey. You may find, like me, the noises and sounds of the neonatal unit quite a shock to start with. There's a lot of beeping and a lot of bonging and a lot of sounds going on, but they're all there just to reassure and support your baby during their journey while they're being looked after. You may also obviously notice that your baby may or may not be covered in wires and potentially ventilators, breathing apparatus. Needles may be having to be used on your baby, and that can be very overwhelming as a parent. The staff are very calm. That doesn't mean that crises don't happen within the unit, but they deal with it in a calm manner and communicate with you what's happening during that time so that it doesn't get too fraught, and I think that's the best way to do it. They're very good at putting you at your ease, keeping you informed of your baby's progress, and are always open to you asking questions. They always make themselves available. They're very busy and they might not be able to speak to you straight away, but they will always make time to come and speak to you and make sure that you are comfortable and fully informed at all opportunities. Depending on how acutely unwell your baby is when they enter the unit will depend on which room within the unit they go into. There are 3 rooms on this unit. The first room is what they call the intensive care or HDU room, and that's where your baby goes if it requires support with breathing and also perhaps more heavy monitoring. And depending on how well your baby does at that time, or depend on how long you remain in that room, it could be a matter of hours, it could be a matter of days or weeks. You will then hopefully move through into what they call the special care rooms or SCABU rooms, of which there are 2 of them, where you go when your baby is perhaps slightly more well, requires slightly less assistance, doesn't need ventilation or any acute management, and you can learn to care for your baby. The staff will help show you how to bath your baby, how to change your baby, how to dress your baby, how to administer medications if needed, ready for when you go home. In order to obtain medical updates on your baby whilst they're on the unit, there are a variety of different ways you can go about this. You can either ensure you're present for the daily ward round, which usually takes place first thing in the morning, and you can speak with the doctors there. The only thing they do ask is that you wear headphones when they are going around the other babies to ensure patient confidentiality. Alternatively, if you aren't able to be in for ward round, which isn't always possible for everybody, you can approach your nurse in charge of your baby for that day, and they will give you a synopsis of what was discussed on the ward round and their plans for the care of your baby for the following 24 hours. In regards to visiting times, you as a parent and any other children that you have are welcome to visit the unit 24 hours a day, 7 days a week. The staff will always welcome you onto the unit to visit your baby. Anybody else has to come within the scheduled visiting times, which are displayed on the outside doors. They're asked to buzz at the doors, and you will then be informed that they are here, and they will wait outside until you come and collect them and take them in to visit your baby. So the unit will actively encourage you to involve your wider family within the journey of your baby. They're welcome to come in during the scheduled visiting hours, to come in and visit yourself and your baby. When going home time comes, you will be usually invited to either come and room in, either in one of the private rooms, or go into transitional care. And again, in there, you are then in with your baby 24 hours a day for a couple of days, making sure that feeding is well established and that you feel comfortable and ready for the next big step of going home.